Welcome everyone to today's webinar, The Intelligent Front Door, How AI is Modernizing the Call Center. On behalf of Becker's Healthcare, welcome and thank you for joining us today. Before we begin, I'll walk through just a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. The sponsor will be sure to follow up via email. If at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. Our team is here to help. At this time, it's my pleasure to introduce today's wonderful presenters. We are joined by Suzanne Katz, who leads Notable's Access and Engagement Solution Development, where she aligns digital solutions with intelligent automation to support daily healthcare operations and improve patient outcomes. Formerly working as an administrator at top healthcare organizations, including Johns Hopkins Health System and the Hospital for Special Surgery, Suzanne directed operational and digital access initiatives, instilling best practices across service lines through facilitation of clinical, administrative, and technical partnerships. Suzanne holds a degree in design and environmental analysis from Cornell University and a Master of Health Administration from the Johns Hopkins Bloomberg School of Public Health. We are also joined today by Tim Getse, who serves as the Executive Vice President of Performance and Integration for Gillette Children's Specialty Health. Here, he focuses on the latest technology to improve the lives of patients and families. His responsibilities include strategy and operations for patient access, charge integrity, information systems, quality and accreditation, and the system-wide process improvement program. Tim joined the Gillette Children's leadership team in 2013. Prior to that, he held several leadership roles at Vanderbilt University in Nashville, Tennessee, including Associate Vice Chancellor. Tim holds a Master's in Labor and Human Resources degree from The Ohio State University and a BA in Psychology from Kenyon College. Tim and Suzanne, thank you so much for joining us today. I'll now turn the floor over to you.
Great. Thank you so much again for joining us for today's webinar. And it truly is a pleasure to have Tim here joining me to talk a little bit more about intelligent automation. Let's jump into the agenda. So first, we're going to break today's discussion into 4 different sections. We'll first start off talking about patients' expectations and how they prefer to access care. Then we'll start the conversation around best practices for optimizing patient access, leveraging intelligent automation. And then we'll spend a bit of time learning more about Gillette Children's and how they approach leveraging automation. And of course, we'll leave a couple of minutes for a few questions. So we want to talk first about what patients are expecting when it comes across the industry in terms of how they access patient care. Of course, research show that patients really expect digital experiences when they're interacting with their healthcare provider. And honestly, it's really no surprise because they're engaging digitally for everything else that they do in today's world. For example, maybe it's around making a mobile check deposit or frankly, just making everyday purchases. Patients are looking for the ability to, have accessibility into their healthcare, for autonomy when it comes to booking an appointment or filling out information online. And of course, they want that interaction to be efficient and to be simple. Yet within our healthcare systems, we have a lot of complexity that's part of the patient access journey. And when we look at the industry, we're seeing that actually 75% of patients say they would just prefer to complete information ahead of time before their appointments. Yet we still have those clipboards in place. We still have a lot of mechanisms where patients have that manual work to complete, even though they're very willing to do that prior to appointments. And so there's so many actions that have to be performed when a patient is coming in for an appointment. Many of those, again, are happening either at the time of the appointment or maybe even over the phone today. But nevertheless, they're taking a lot of time and patients are actually looking for different channels to engage with us and to interact with us. Because essentially, when we think about it, they're doing it for every other activity in their everyday life. So let's start talking a little bit more about call centers. So let's jump into the conversation around call centers and patient access teams. This is incredibly important, when we're talking about some of the pain points that healthcare institutions are experiencing today, because we are really trying to optimize our processes. We're really trying to be thoughtful in the way that we are approaching how we set up our systems, how we are interacting with patients, how we ensure it's a great experience, no matter how a patient wants to see us and when. And you can see that already there's a disconnect, right? We just talked about how patients want to engage through digital tools, yet the primary way that we have patients access care today is through the telephone. So there's very clear challenges in this space. Of course, there's the high call volumes, there's highly manual or repetitive tasks that need to be completed, and then there's actually limited ability for administrative staff to proactively engage patients in their care, help them schedule, help them fill out information. As a result of all of that high phone volume, they're focused on that inbound work. They can't even get to it given how much work is in this space today. And when we're looking at studies, 61% of patients actually acknowledge that they are bypassing receiving care because of the hassle of scheduling appointments. So many are passing on preventative care, maybe even waiting till emergency care is needed. And we know that that is not the best process for getting patients, making sure they stay healthy and making sure that they stay engaged in their care journey. So let's take a look a little bit of the data. We've done some research on this. And of course, looking across, we see approximately 52% of those surveyed mentioned that it takes more than 6 minutes to schedule a visit. So that's over the phone, of course. Now, this doesn't take into account a couple of other components, right? 6 minutes is that actual action of completing that booking. There might be pre-call work, there might be post-call work. Many times it actually takes multiple calls to schedule an appointment, right? When we think about first call resolution. And so when we start adding up all of those data points, we actually see that it can take an incredible amount of manual time, manual work from staff to help a patient book just one appointment. And then when we think about all the rework, right, when there's cancellations, when there's rescheduling, there's a ton of time being invested. And frankly, the process today is very inefficient for helping patients access that care. So of course, call centers. Why did we develop call centers? Why are we making such investments in our administrative teams? Well, they're developed for a very valid and important purpose, right? We need help managing the workflow. We need help standardizing processes, creating optimization, really creating efficiencies in the way we manage patient access. But in turn, we've actually created an incredible amount of work that staff are performing and having difficulty managing. Groups might have actually started to make some investments in technology, but frankly, many are falling short, which is why we're seeing this disconnect and this high turnover environment when we're talking about call centers. For example, maybe there are some resources in place to allow a patient to fill out, forms online prior to appointment. But a lot of those tools actually don't have the intelligence behind them to ensure that when that information is completed, it's truly completed, it's personalized for that patient, and that it's carried back into the appropriate source system. Many times that's the EHR, and many times it'll end up in a work queue for then staff to have to rework that specific form, or maybe even have to completely redo it, which essentially, results in more calls for the patient, results in more back and forth, and actually results in more work overall in terms of completing what could be a very simple form. So it's no surprise that there's this major burnout and a major risk for staff working in these environments because the work continues to grow, and yet the tools that they have today are not comprehensive enough to really help them do what they need to do on a daily basis. So let's talk about impact. So of course, the cost to support call center operations is incredibly high. We just talked about turnover, and with the way that the work's being completed today, we need more and more people to do the work to support the growth in our organizations. When we think about it, many folks are turning to staffing agencies, looking at outsourcing, looking at overtime as a way to help fill the gap that they currently have in their operations. But again, we know that's not sustainable, and frankly, those solutions can be quite costly. When we look at just the cost of an average phone call, there's significance in there when we think about how high our call volumes are today. And it's been shown that we can actually reduce that cost significantly when we look at other ways to perform that same interaction, just do it digitally. And then, of course, on the other side, thinking about revenue, we see that there is leakage and there are opportunities to really think about how we transform the access experience. Let's take referrals, for example. Many organizations are receiving patient referrals, but the processing behind, managing those referrals, bringing them into the system, outreaching to the patient, there is recognition that there's a lot of lost revenue because we're not capturing those patients. We're not doing it timely. We're not being quick enough in our interactions. And so there's opportunities all along this path to really say, we know that the costs are increasing. We know our revenues are decreasing. We really need to flip the balance in how we're thinking of approaching this. And so what does this mean? It means that it's really time to rethink our approach overall. Adding more people to the process is no longer that sustainable option, but this is a great opportunity for where intelligent automation can be used. So let's start off. We're going to talk about 3 best practices, and I'm excited to have Tim join into the conversation here. And the key here is to think about how we address patient expectations, right? How do we start to reimagine how we think differently around call center operations or truly patient access as a whole? And then what outcomes can we ultimately drive, and how do we achieve those outcomes along the way? So our first best practice, and again, this one's a fundamental one, but so incredibly important, is about how do we match the right patient to the right appointment with the right provider. Very simple in nature, right? But actually very hard to execute when we think about how complex our organizations are, how many rules we have behind the process, and how many nuances there are. And that even some of the best schedulers, folks who have been doing this for quite some time, it's easy to make errors because of that complexity. So any tools that are being implemented need that advanced logic within the system so we can help guide patients and help bring them to that right appointment with the right provider, and recognizing that there needs to be other options outside of that call center, outside of that phone call, to help patients book those appointments. I'd like to pause here for a moment and give the floor to Tim. Tim, I'd love your perspective here. What do you find are the risks of not doing this? Why does this need to be an important part of an intelligent automation process?
I think you hit on much of it, but the intelligence piece is so important in coordinating the care. In some place like Gillette, we have very complex patients, and many times they're not coming in just to see one provider. Maybe it's 2 providers, and maybe they need imaging in relation to their visit also, or coordinate a therapy visit. So this intelligent recognition of which providers are available and best suited to serve them is critical to the experience.
And I'm curious too, in your experience, does the EHR have these types of tools today? Are they well utilized? What's been your experience there?
Well, as we know, EHRs have had some scheduling features for quite some time, and we did deploy some of those prior to our work with Notable through the portal. And I think what we found there is it was very transactional for the patient, and it was very cumbersome. So they'd have to come in, they'd have to be searching for the provider. Maybe it showed them some providers they had seen before, but that may not be an actual fit for what they're experiencing currently. So we did have a lot of those mismatches that you had stated, and somebody reviews all of those in the back office, in addition to the person having to do it. So you are not really getting much efficiency either, and the patient experience was poor because of that kind of lack of push and lack of intelligence.
So let's move on to our next best practice. So this is really crucial, and I'll actually let Tim take the floor here, but the next is really thinking about how do we guide patients through a personalized pre-visit intake experience that helps them collect that information from patients up front so they can have a seamless experience when they walk through the door. So Tim, can you flesh this out a little bit more? What's been your experience with Gillette Children's, and how have you seen success here?
Yes, this has been a highly impactful area for us, and one of the first that we tackled with Notable. We have a lot of order-based appointments and things like that that are coming up, and we do the notifications to the patient, oh, you have this upcoming appointment. But when it prompts that patient to register, it has the intelligence of knowing all of their past visits, what they've done. So it's smart in that regard and asks the right questions and is able to capture it more efficiently. When I say impactful for us, it's the user experience as a whole and the staff experience, really, because this is a lot of times very difficult for families to collect. They may be here with their child and their siblings and trying to manage all of that process while doing their registration, in person. So we would have long lines in the wait room. We would have a full wait room many times. That's not fun for anybody. By the time they get up to the staff member, they're not feeling good, which makes the staff experience much harder. So by using these best practices, we've been able to basically eliminate the lines and eliminate the waiting in the room. This experience, my daughter is a Gillette patient actually, and I tested this out the first time we did it with her actual appointment. And I was able to do her registration, get everything done within just a few seconds and didn't have to do anything at the front desk.
And of course, third, and Tim just touched on a couple of these key points. It's really about prompting patients, right? How do we let patients know when care is needed and prompt them to take action as appropriate? And this can be for a multitude of things, of course. It's about maybe a patient has a care need, maybe they need a follow-up appointment, maybe they're due for annual wellness visit. So many options out there, but we want to find an easy way to remind patients when care is needed, proactively outreach to them, engage them in the form that they're looking to be engaged. So giving them those digital tools at their fingertips, whether that be via phone, via email. We know they're using those mechanisms for other things that they're doing today. And ultimately, not waiting for them to come to us, right? When something's needed, we want to make sure that we're providing the best patient experience overall and that we're outreaching whenever needed. We just talked about within the call center, because of those operations, that proactive nature isn't something that can be implemented today with the shortages that we're having, with the staff just being overwhelmed with the amount of manual work. And so we really want to engage patients in this process. And I'm curious too, Tim, what are some of the goals that you have as it relates to proactive online scheduling? What are your thoughts about this space?
Yeah, and as I said, our patients are very complex. So the scheduling, as Suzanne indicated, is not very scalable. It's not scalable at all when you're thinking about calling into a call center and things like that. When we talk about those, not only the wait times to get in, but if you're coordinating 3 or 4 different appointments, that's probably a 20, 25-minute experience in many cases for our families. So very cumbersome for our staff. Our goals here are that those 3 or 4 appointments can be scheduled through the family's phone in just a matter of a couple seconds at any time of the day or night that they choose to do that.
Yeah, I love how you brought that up, Tim, as well. Of any time of the day or night, right? Most operations today are 9 to 5, or maybe they've pushed out those hours, but it's limiting. And with that too, what does this mean for your staff too? I mean, you have an incredible team there who's doing so much incredible work, but what does this mean of opening up this access, and how is that going to impact the staff overall?
Overall, we want our staff to be doing the highest value work that they can for the families, because there is a human component that still exists. And that's more satisfaction for our staff members if they can focus on the things that need the most attention. And if the family can do many of these things themselves, then it improves the experience all the way around. The staff are happier, more fulfilled, and the families are likewise.
And I think Tim just explained it so well, but want to give a few more examples of where our partners have just seen some incredible results relating to implementing some of these best practices and more. And again, thinking around intelligent automation. So how do we think end to end of how do we support the patient experience, the staff experience, the clinician experience, and achieve those really strong outcomes? So for example, our partners at North Kansas City Hospital, they worked with us to implement online scheduling, registration, and they said that investment is really helping patients, removing that burden of them determining when care is needed. And they're seeing it impact immediately, driving up new patient appointments. Our partners at Austin Regional Clinic, powering touchless registrations. It's one of those we've talked a lot about, touchless, digital front door for years now. Now we're actually seeing that come to life, and showing that when you collect high fidelity data on the front end, it leads to incredible outcomes on the back end. For Austin Regional Clinic, this meant a significant reduction in their registration related denials, because that information that was collected up front, the patient interacting, was accurate, bringing it back into the EHR and producing those really strong results when it came to billing. And then, of course, our partners with Castell, recognizing that they said, how can we be more proactive in engaging patients? How can we be proactive in identifying care gaps? And so overnight, they saw a transformation in leveraging Notable's intelligent automation, saving significance in terms of FTEs and just time and manpower, in terms of, proactively recognizing when care gaps have already been closed, when they still need to be filled, and then be able to take action based on that automation in the background. So again, so many positive results, but really seeing that impact that are both going to help drive, going to help, essentially facilitate reducing that cost and increasing that revenue. Wonderful. And now, Tim, thank you so much for joining into the conversation. I want to, jump a little bit, outside of this and talk broader about intelligent automation overall. But of course, before we jump in, can you tell us a little bit more about yourself and a little bit more about Gillette Children's Specialty Health overall?
Sure. Well, we went through some of that in the bio, so I'll talk maybe a little bit less about myself and more about Gillette.
Great.
But I've actually been kind of in the automation space for a long time. My career started really with a startup called PeopleSoft, and I was on that team doing workflow. So this has been with me for quite some time. You see, I'm not the typical technology person, I would say, with a psychology degree and human resources, but I really value those aspects of my background in trying to bring value into the user experience here at Gillette. Gillette Children's, I believe, is a really special place. We're not your normal healthcare system. We focus strictly on kids with complex brain, bone, and movement needs. This equates to conditions like cerebral palsy, scoliosis, traumatic brain injury. We focus exclusively on those complex cases. We do not have a large primary care population or anything like that. We rely on the primary care providers to do that, and they come to us for the very specialized care. And I think that has created a unique culture here at Gillette, where it's more about managing these relationships that can go on for up to a lifetime in some cases, or rather than an episodic type of thing where the patient's here, gets cured, is gone. That's really not how our environment works. So we develop relationships with these families and these kids, and it creates a very special connection, I feel like.
I appreciate that so much, Tim. I've had the pleasure of working with many members of your team, and you could feel the compassion as they're working with patients and as they're thinking about how to care for patients from all aspects, whether that be, booking and scheduling appointments, to actually being in the exam room and working with patients. So thank you to you and your whole team for all the incredible work that you do. Want to start off with, kind of the fundamentals of today. Do you view intelligent automation as critical to transforming patient access?
Yes, and even more than just access, we really feel like when we started to approach this problem, we did not approach it from a cost saving standpoint. It really came about because we had some automation, we had Portal in place, we had some of those things. But when we started to think about what we really wanted to do in providing value in healthcare, it really meant a better family experience, which would translate to better care. We want wellness with our providers to have a good experience. Certainly we want to be cost efficient in doing that, but we also want to improve population health as a whole. And we started to look at the challenges of that quadruple aim. And obviously the way we were trying to go about that was not scalable in any way. And that's where we came around to, if we're going to achieve what we want to with the patient experience, we need to bring intelligent automation into the equation so that we can do parallel efforts, which we have created within my area in outcomes evaluation, population health analysis, care pathways, care navigation, those types of things that enhance the user experience. And we found that in order to do those, we needed to have a strong complement of intelligent automation in order to achieve those goals.
You brought up, so many great points there, Tim. I'm curious a little bit too, you talked about the scalability of it. Many organizations are looking at, hiring more folks and bringing on, more members of the team. Do you see that as a sustainable path going forward in terms of addressing some of these challenges?
Absolutely not, because, and you hit on some of those earlier, it's a really difficult space, especially in this post-pandemic time, to recruit and keep personnel to perform those types of transactional opportunities. And what we're finding is through intelligent automation, we can, like I had mentioned, reduce those areas and invest our time in the things that add more value. So we're adding outcome specialists, we're adding navigators and things like that, where they can help to facilitate the improved care with the patient. And we're not really kind of throwing money at a problem that's not going to get solved anyway.
Thank you. You know, and we touched on it a little bit before, but, you know, one of the things that, you know, I recognized in first meeting with the Gillette children's team is just truly that compassion they have for patients and how they care for them. It's in the mission, it's in the vision, it's palpable when you're there. You know, what are some of your best practices for maintaining that culture? And how do you think about, you know, implementing automation and still being able to support and maintain a culture that's so unique and so special?
One of the things I think that is important about the culture that we have is that concept of a care team that meets the multiple needs of a particular patient, and having that be a coordinated and seamless effort. You know, one of our patients, a cerebral palsy patient, may have neurology needs as well as orthopedic needs, and they may be in therapy, as I said, and they may have a wheelchair or a brace. We really focus that as a holistic experience here at Gillette. It's not, okay, you need to schedule your neurology appointment, and you need to talk to your ortho provider. Many times those providers will be with the patient at the same time, and we coordinate those visits so those experiences can all happen. So it really is a team effort in managing the relationship with the family. And I think the intelligent automation really helps us do that, because the patient sees that connection when they're here at the clinic, and they see that connection when they're engaging digitally. It's all fairly seamless to them.
Amazing. You know, and you just mentioned, you know, how Notable is helping. What are some of those tangible outcomes that you're already seeing?
We certainly see that in the family satisfaction. What was probably one of our highest occurrence reporting or family complaint areas is trying to get in, because I've got all these things I have to do and I can't get in. Our patient satisfaction scores with using Notable are generally 99% satisfaction rate with those. That's been a huge difference for our families. Our employment engagement numbers are up in these areas that deal with it. In the call center as well as at the front desk, those employee engagement scores have all went up. And as we start to move our efforts into the clinic with intake forms in the clinic, we see that too. The burden on the nursing staff goes down because the patient's already filled that out. I'm really excited about the full journey when we get to the point of, and we're going to be piloting this soon, of then evaluating outcomes through the Notable platform for the patient. So post visit, you know, how did that go? How are you feeling 6 months later? Those types of things.
And I know it's still early in the journey, but are you feeling that we're meeting those patient expectations? Are we meeting what they're expecting as far as their care journey and how they can engage with Gillette Children's?
Absolutely. It's all smiles as they come in to do these. So it's been really great. And all the feedback has been positive from the families. So we're real excited about it. And the nicest thing to see too, as I mentioned, is the staff don't feel like there's, oh, you're taking my job away or anything like that. They see the value to the patients, and they're like, hey, I can devote my time to something else that's adding value. So they're very excited about it too.
Amazing. It's great to hear how, you know, intelligent automation can be leveraged to really support staff and what they're doing and help them achieve, you know, their daily task and really be a mechanism that they can lean on as, you know, they're thinking about how they can be more efficient in their work and frankly, just serve more patients and get to what they do and what they love to do overall. Little bit, you know, important because, you know, Gillette Children's has a very specific focus. And one of the things that I think we recognize is that many complex and subspecialized organizations can sometimes be more hesitant or maybe more skeptical around implementing automation given their unique populations. Given Gillette Children's has a very subspecialized population, what advice would you provide to similar organizations that are looking at automation and how they might want to implement it?
Yes, I can do that. And I agree with that. I would even put early in our journey, Gillette into that bucket of being hesitant to dive into that. And some of that hesitancy really came from our providers initially saying this has to be a much more personal experience. We can't, you won't be able to automate it. It won't be able to be that intelligent. And because we care, or those providers care so much about the relationship and the experience. So when you have this complexity, it is a little scary to approach it at first. But I think the thing that really shifted for us was to have the dialogue about, this is not about cost savings. This is all about the patient experience. Though we feel like this can actually enhance what we're doing with the patient, because we can then improve outcomes, have more patient navigation, real time, and things like that. So we really approached it from a patient experience first standpoint, which really eliminated the parts of the conversation with the providers saying, you're just doing this to save money, and things like that, because that's not helpful, because it's great if you do in the end, but it wasn't the purpose going into it for us. And I think if you're a complex care organization, that's really the way to approach it, of how to enhance the user experience, because the family is already dealing with tons at home because of the complexity of what they're doing. So I think that's been really helpful for us and allowed us to tackle some of those problems with the support of Notable, of the coordinated visits and the complexity. And I know in doing this, we do strive to be leaders and set an example to say, if we can do it here with this complexity, then other organizations with complex needs could do it too.
Thank you. And I think, you just touched on a couple of key, initial outcomes already, Tim, but, given all of this investment and all this work that we're doing together, what's your future vision? What is this going to look like in 3 to 5 years? How do you envision leveraging automation to really transforming clinical operation, patient engagement, all of those components we've been talking about? What does that look like?
Yes, we really see it intertwined through the whole experience. It's clear you kind of end up starting with the scheduling and registration component, but as I mentioned, we start to get into the clinic intake and automating that. And then maybe there's an upcoming surgery, and how do we get into scheduling surgical events perhaps? And then with that, there's always a very complex prior auth that happens. It's very burdensome for everyone involved, provider, staff member, and the family. And it's not getting easier, certainly, as most healthcare organizations see. So automation and intelligent automation within the prior auth. And then ultimately, like I said, on the outcome evaluation and the population health, being able to check in and get feedback from the family related to their care pathway. And are they being compliant with their care pathway? Are they getting the most out of it? How is that working for them? So it's a complete digital experience from start to end that is valuable for everyone.
Amazing. And what other advice would you have for, healthcare systems or organizations that are exploring automation, but maybe they don't know where to start, right? Sometimes it's what's the starting point? How do I jump into this? What would you say?
Pick the right partner. I think obviously that's a big part of it. But as I said, kind of really define what you want the end result to be ahead of time. It's not automation just for automation's sake. I tell people that doesn't really add much value. I use the example of, we all see this go through the self-checkout line at the grocery store, and certainly that's an automation. It helps the grocery store not have to staff it so much, but it's really not a great user experience. That's kind of how we sell the portal in our efforts. So when we went into it, we wanted to define the end result we wanted. We want higher patient satisfaction. We want a better patient experience than just automation.
Thank you. Well, thank you so much, Tim. I know we could talk for hours on this, but really appreciate your time. Thank you for being incredible, partners with us, and thank you for letting Notable be part of your care team. We're so excited to keep working with the group and keep achieving those outcomes and really, just driving the patient journey and creating a great experience overall. So thank you so much.
Thanks for having me. We're excited about the future also.
All right. Thanks, Suzanne. Thanks, Tim. A lot of great insights shared. I'm just taking a look at the questions. We have a few coming in. And Suzanne, it looks like this first one might be for you. There's so much out there about how AI is being used today that it's almost overwhelming. How do you think about applying AI when building out solutions?
Ooh, that is a great question. It's one of those, particularly even in the last couple of months, AI is a buzzword many times. It's a little bit of everywhere, and you almost don't know where to look. So I really love this question and, appreciate it. But when we think about applying solutions, I think the answer is we have to be strategic in our approach, right? We have to be strategic in the way that we're thinking about building it out. AI has so much power behind it, but you have to do it in the right way, especially when we're in the healthcare environment. You have to do it safely. You have to think about the ways that essentially when you're looking at intelligence, when you're looking at automation, what's the goal? What's the outcome going to be? And what's the most efficient way to do that? And so it's never a one size fits all. It's never, let's just apply this for the sake of applying it. I think it's about being thoughtful. Again, that safety is crucial in the context of the environments we work in. And ultimately, really think about, what is the best tool for leveraging and creating those strong outcomes on the back end. It won't be a one size fits all.
Agreed. Great insight, Suzanne. So this next question is for Tim. Do you believe that automation will help you bend the cost curve over time? And what feedback have you received from your staff about these automation tools?
I mentioned a little bit about the feedback from the staff, which has been overwhelmingly positive just because they see happy faces, not angry ones, in front of them. So that feedback from the staff has been great. I'm sorry, what was the second part of the question?
Yeah, so let me go ahead and just repeat the question again. So do you believe that automation will help you bend the cost curve over time? And then the second part was around the feedback for staff, which we had addressed.
We definitely see a high return in the cost model moving forward with the intelligent automation, because I alluded to it a little bit, is you're able to spend money on more high value efforts to enhance the experience rather than spending so much time on the transactional aspects of the cost model. So you're really redistributing your investment from one low return area to a high return area. That you end up also, from what we see and learn, is that patients and families that are highly engaged seek care more often and are more involved in their care. So clinic volumes do go up, and people are more actively getting their health in order. And we hope to see through our population health efforts, less emergency room visits, shorter stays in the hospital, and things like that. So it's a great determinant of a better cost model.
Awesome. Thanks for sharing, Tim. Suzanne, I'm going to bring you in for this next question. What about patients that don't want to engage digitally? What options does this leave them?
Oh, I love that question. So of course, there's always going to be folks who prefer different interactions. We've just, shown that in some of the research we showed earlier on. But I think there's an important, aspect to this around, sometimes I think folks implementing different tools say, well, we have to have 100% completion to show success. It's actually not that at all, right? You want to engage patients in the way that they prefer to be engaged. So if you have a population that's looking digitally, you want to be able to engage them there. For folks who are not looking for that, or frankly, folks who might need a little bit more guidance, a little bit more of a personal touch, digital engagement and automation actually helps everybody in the process, right? If you have 50, 60, 70% of your patient population completing, information ahead of a visit, that means that other 30, 40%, so on, can now spend that dedicated time with the team that they need because they need a little bit more of that human touch, because they need a little bit more of that interaction. And so it's more so around giving patients different tools to help them engage in the way that they want to, and then really opening up the door for patients who do need that personalization, who do need that, additional touch, who do want to spend additional time. And so again, there's benefit for everyone in this. And ultimately there's ways that essentially you can create a lot of value if you start to make these investments early on and really think about the different ways that patients want to interact.
Great, thanks, Suzanne. Looks like this next one's for Tim. Prior to using Notable, did you try automating some of your workflows internally?
Yes, we did. So we are, with our EHR, we tried leveraging some of that platform in the portal to do some of that automation. And there was adoption with that. We did get results. They weren't necessarily enthusiastic results or embracing, because it is it does put a lot more of the burden on the patient still. We can send them a text reminder, but they then have to log into the portal, navigate it, lots of clicks, and then schedule it. And then that maybe end up being an incomplete schedule. Maybe they forgot about their imaging or something like that. So we saw that type of behavior with that. And that's where we said, we've got to improve the experience. And that's when we brought in Notable to make the process more intelligent.
Awesome. Thanks, Tim. And just a follow-up to that, another question, how much effort does it take from your team to implement automation tools? Does it take months or years to set up the technology?
It depends on which effort you're talking about, but in everything we've done with Notable, everything has really been in the months and been incremental in that regard. And we try to do that just because people work better in that environment when they're seeing results along the way. So, not trying to do everything before you do anything kind of scenario is just incrementally build it out. And that's been really good for us. So we started seeing results just after the first few months, and we continue to kind of work at that cadence moving forward.
Awesome. Great to hear, Tim. All right, so that's all the questions that we're able to get to today. If we didn't get to your question, we'll be sure to follow up with you after the call. But I just want to take this time to say thank you to all of our attendees, to our wonderful presenters, to Suzanne, to Tim, and we will talk to you soon. Have a great day.